You're on mute, Doc.
What's that? Are you ready? Good
Go ahead,
morning.
Doc.
Good morning if you're here in the U.S. Good evening if you're in Europe, and not sure exactly what to say from some of the other parts of the world, but about 47% of our viewers are outside the U.S. So very global reach. Today we're going to be talking about a Russian study that was presented recently at an endocrinology confab, an endocrinology meeting. They translated the term vital exhaustion. Most of us just know it as stress. And sure enough, in terms of a spoiler, yep, stress causes heart attacks. And guess what? You ever hear the old joke about spouses? You know, women say it about their husbands. You can't live with them, can't live without them. For this study of men, they saw the same thing with husbands and families. You may get frustrated with them, but you can't live without them. It's a major stressor to be alone. So we'll go over some of the details. Before we do, we'll talk about some of the other topics we have available. Talked about diabetes prevalence. Just a short summary of that was that recently they've been saying we've decreased our incidence of diabetes throughout the world. Not so fast. You know, they talk about lies, damn lies, and statistics, and this was a problem with statistics. Diabetes and insulin resistance is still growing very much. And it's the number one cause of the number one killers and disablers. That's what this channel's about. We've had some discussions about ketogenic diets, other things as well. The couple of other comments, the things that you tend to miss and the things that you can start accessing with Dr. McChord and myself, those of us at PrevMed, are things that your docs tend to not know. Number one, cardiovascular inflammation is the cause of heart attacks and strokes, not just plaque slowly clogging the drain like hair clogs the drain of a bathtub or a shower. The second thing is, by far the most common cause of cardiovascular inflammation is insulin resistance. Over 90% of it is undiagnosed. Same thing with diabetes. Diabetes is a severe form of insulin resistance. Prediabetes, or you got a touch of sugar, is a lesser form of it. In reality, so many people have the lesser form, prediabetes. The prediabetes causes more damage on a population basis than the full-blown diabetes. Take the course and you'll find out why. Final item, plaque evaluation, cardiovascular plaque. You know, people get a positive calcium score. That's one of the most common reasons for coming to see us. And here's one thing that they don't know. The old way of evaluating plaque. So you get the doc will ask a few questions of Framingham. Framingham's a guess, not a measurement, and it's a bad guess, resulting in maybe up to 50% of unnecessary statin recommendations, especially for women. After the Framingham, they often go to your doctor often goes to a stress test. A third to a fourth of stress tests results are known to be wrong. The stress test will take you to a cath lab. Well, again, it's a dangerous way to measure and picture your plaque. There are better ways to do that, and you can learn that in just a couple of hours taking our plaque evaluation course. I'm not going to discuss scripts today. We'll give you a quick update on the book. Bottom line is we seem to be getting closer to a publication date. I'll just leave it at that. Today we have Dr. Kevin McChord with us again. When he joined us before, it was a very popular topic. And the topic today is something that's near and dear to Kevin's heart, as well as mine. You know, both of us have worked in organized medicine for many years. Both of us felt and understood some of the challenges that you get with organized medicine. Let's just take a quick look at the article that was presented, and then we'll start discussing it. So again, the term they were using in terms of their interpretation was vital exhaustion. It was a research program. It was article presented at the 2021 Acute Cardiovascular Care Conference in the European Society of Cardiology. It found an association between stress or vital exhaustion and heart attack in men. This is not new. It's replication of stuff we've seen many, many times before. This is a European Russian view on the prolonged or inescapable stress and cardiovascular risk. It refers to excessive fatigue, feelings of demoralization, increased irritability, particularly when they're unable to adapt to prolonged exposure to psychological stressors. Now, some people would say maybe there's a type A personality and type Bs and maybe some other personalities who actually thrive on stress. That's not covered in this study. We may want to talk about that a little bit later in the discussions. In this study, they looked at 657 men, ages 25 to 64, in Novosibirsk, Russia. I don't know where that is, but that's where the study was done. They did an evaluation using what they call the Maastricht Vital Exhaustion Questionnaire. The subjects were followed for 14 years since that questionnaire was done in 1994. The results: 2/3, 67% of the men had vital exhaustion, 15% had a high level, 52% had a moderate level, and nearly 3/4, 74% of the men with high blood pressure had what they termed vital exhaustion, high levels of stress, 58%. Men with moderate or high levels of stress had 2.7 times more risk of heart attack within 5 years. This is adjusted for things like age, blood pressure, smoking, and other things. 2.25 times within 10 years and 2.1 times within 14 years. The risk of a heart attack linked with stress was higher in never married men, divorced men, and widowed men compared to married men. The ratios were 3.7, 4.7, and 7.0. So there was 5.9-fold higher risk of heart attack with 55 to 64-year-olds with stress. So yeah, stress is a killer. What can we do to prevent this? Well, living alone indicates less social support, which is an independent risk factor for heart attack and stroke. Efforts to improve well-being and reduce stress can help reduce vital exhaustion. Involvement in community groups, together with a healthy lifestyle, these measures can be helpful. So, Dr. McChord, you want to start us off with a couple of comments?
Well, good morning and greetings to the entire PrevMed audience. And thanks for having me on again. It's a pleasure to be here.
Thank you so much. So, one of the first comments about this was, please talk about adrenals and cortisol levels and other hormonal issues. You want to start with some comments on that, Kevin?
Hey, we can start with that, certainly. You know, if we try and define stress, I suppose certain things come to mind. A basic dictionary definition gives us stress as a noun. It's a state of mental or emotional strain or tension that results from adverse or very demanding circumstances. Of course, stress can also be a verb where we apply a particular emphasis or we're making a point in, let's say, speech or writing. But when we talk about stress and its effects on our health, we've got acute stress and we have chronic stress. Now, acute stress is what helps us adapt. This is in the moment. This is fight or flight. This is the way we survive. So that's a beneficial mechanism. The problem we're talking about, what we're addressing here in relation to heart attacks, is chronic stress. I don't know how members of our audience may relate to this, but you feel like you go through life with one foot on the accelerator and the other on the brake. You continue applying both of those all the time, and it keeps the body in this heightened state of a slow burn. We're talking about inflammation. We're talking about cardiovascular inflammation as a primary mechanism of coronary disease. So insulin resistance as one of the core mechanisms is often accompanied by adrenal dysfunction and excessive cortisol states. So we apply this continual state of emotional or psychological stress. It activates portions of the brain and the pituitary and the adrenal glands that produce a hormone that's intended for survival. But when we run that continuously, this leads to exhaustion. There's association with depression. Other aggravating factors, of course, that we bring on that don't help this inflammatory state with an inflammatory diet of ultra-processed foods. For individuals who have snoring or sleep apnea, all of these are drivers of abnormal levels of cortisol that are supposed to vary through the day. We have a normal diurnal cycle of cortisol. But when this remains at elevated levels, it produces damage.
So have you seen some of the research, speaking of sleep apnea, have you seen some of the research regarding cortisol and sleep apnea?
I have seen articles, and I know you have always got a wealth of data. So I'd be interested in what you've got.
No actual data, but information. It's just amazing the impact on cortisol. And again, some very, very simple facts. For example, out of the book, Why We Sleep by Matthew Walker, he talked about some research indicating where people in a sleep lab, even if they had sleep that just showed up, some challenges that just showed up in terms of the lab, but they didn't notice it. They thought they had a good sleep. If they had problems in terms of sleep, they had increased insulin resistance for the next 48 hours. And that's when people aren't noticing it. You get full-blown sleep apnea, you get huge increases in cortisol. And again, we wonder why that's associated with increased mortality. When you and I met, you shared with me that you'd been involved in some organized approaches to medicine and some of the stress involved with that. You care to share any of that?
I would be happy to, not only for the benefit of our audience, and of course, here we're speaking about information that relates to men. Women, you're welcome in this conversation as well. We're all in this together. I think there are a certain set of issues that men find in their mindset. And if we have physicians in our audience, male or female, I think we are among some of the worst professionals out there to deny our own stress, our own pain, and we're not forthcoming. We're not honest in admitting that. So when we think about what stresses our health, and speaking of, previous employment and so forth, I mean, these sources of stress can be internal or external. Think of this as arising from strain or toxicity. So it might be physical injuries that we sustain. It might be a career that's very physically demanding that applies wear and tear on the body. We might carry an inability to detoxify. So we've spoken of fatty liver before, and that is certainly an impairment, clearing toxins that leads to something we call oxidative stress. There are environmental toxins or other things we're exposed to. Those, again, are things that stress or toxify the body. But it's this emotional stress, it's continuous conflict, toxic relationships, and toxic employment. These things slowly poison our souls. And so it's this soup of chronic stress that leads to all kinds of disease. And unfortunately, it wastes a lot of amazing human potential. So if we think of stress as something that steals your energy and makes you hurt, chronic stress takes us to points, unfortunately, of burnout and suicide.
So I don't think women are immune to it.
No.
If Janice and I think, are both very typical. I get my stress from my work, and she gets her stress from her family. If the kids get sick, it is a major stressor for her. And for me, I remember one of the most stressful, prolonged periods for me, again, was very much work related. I had always looked forward to the time when I was involved in a C-suite position for a large company and left and really didn't have to work. Well, that happened, 5, 6, maybe 7 years ago. And I should have known. I never really thought that much about it, but it was the typical retirement, go crazy kind of mode. And didn't like myself, didn't like anybody else, and had to get back involved in doing things. And yeah, I think both of us are very, very gender related in where we go with our stress. Have you seen any of the stuff that I've done on devices, breathing devices?
Yes, I've seen some of those resources you have out.
Have you used that, the Respirate?
I haven't used that one in particular, but one of the things that I'll tell you was just awareness of my own biometric data is wearing one of these, personal fitness device. This one that I use now has the capacity, and it will monitor an O2 saturation in variability through the night. And I'm still surprised by the number of brief awakenings that I experienced through the night. And I still think that, I'll just put it this way, that's still an opportunity for some health improvement. But the awareness of it, I never had that.
I never had awareness of the impact of breathing. You know, you read a lot about meditation, and you read about monks and yogis doing decreased breathing rate, slow down, shallow, stop the shallow breath, take deeper breaths. I tried that many times over decades and really didn't get much from it. But when they said slow, I didn't know they meant that slow. You can get down to like the normal breathing rate's like 20. This is getting down to 10 and 11 breaths per minute.
Right.
That slowed rate. And then another component of breathing, extending the exhalation far longer than the inhalation. And again, both of these have different impacts, but both of them have an impact on our sympathetic tone, our fight or flight tone.
Correct. This is profound. It's profound in rebalancing the sympathetic and parasympathetic nervous system. So those activities that run automatically in the background, but some are more cortisol or epinephrine dominant, and others we associate more with states of rest, of digestion, periods of peace. The breathing is so important to that. Some work that Angela and I are currently doing has made us very aware of breath. It's and how tight we are. We're up in the chest. Instead of breath coming from down low, it's in the belly. We feel it down lower. And it's amazing the effect that has on the placement of our organs, the amount of constriction in the chest and the abdomen, our posture, our tone through the day. And this is connected. Ancient wisdom connects the breath with life itself. So it's a beautiful practice to become aware of. It's been an eye-opener for me.
So let's go to some questions. Bambi Grage, good morning, Bambi. Bart Robinson, good morning. Tuned in and looking forward as always. Ashwan Kumar, good morning. Ashwan, I don't remember hearing from you too often before now, but we're getting a lot of comments and questions. Martha Reich, good morning from soggy, cold, and windblown Mississippi. Good morning, Martha. Thomas Handyside, good morning. Joe Tocho, good morning, docs. And Joe says, my grandmother's family is from Foxworth, Columbia, Mississippi. Still own the old family place. So that's a good thing. Let me see if I can get this. Well, we're starting to get a lot of comments here. Okay. Looking forward to my consultation next Tuesday. I'm looking forward to it as well. This is James's Aunt Martha. She has provided a lot of comments and got very interested in the impact of blood glucose. Hot Wheels, stress test means nothing anymore. You know, it's a very interesting point, Hot Wheels 66. Stress test activities have fallen off a cliff during COVID. And with it, so has cardiac catheters. Now, you would assume that those are life-saving procedures, right? Well, my son works in the meat department at Kroger. Actually, now, he used to work in the meat department. Now he works in produce. And I can tell you, these guys are not missing a day of work. They haven't missed a day of work throughout the whole COVID shutdown. But docs that have spent a lot of time doing stress tests are just not doing them. Now, you would think, again, that would be a life-saving, essential activity. But here's what happened. Over the past, actually, it's been more than 2 years. It's been 5 or 6 years. The Courage trial, the ischemia trial. Several other trials have been published in journals like the New England Journal, Lancet, JAMA, indicating that the obvious, as often happens, maybe the obvious is not as true as we all assumed. We all assumed for many years, for decades, that a stress test was going to prevent a heart attack. And what they showed, I think it was the Courage trial. They actually did randomized clinical study, meaning they took people that were supposed to have a stent, took them into the ER. This happened in England, U.S. Don't think it ever would have happened in the U.S. because it wouldn't have gotten past the human subjects review boards. They took people in, they prepped them for surgery. They even put them under anesthesia. The study group, they did the stents and, well, no, the other way around. The control group, they did the stents. The study group, they did not do the stents. And Kevin, you know what happened with that trial, right? So
Yeah.
it did not, the stents did not prevent heart attacks. Now, stents are great. If you're having a heart attack, quite often a stent is the appropriate treatment and it can be life-saving. But
Right.
up until this past year, only 10% of stents were placed for that reason. The other 90% of stents were done because doctors thought, you know what, we can prevent this heart attack because we see plaque there. Not happening. So good point, Hot Wheels 66. Thanks for giving me the opportunity to make that comment. Ashwan Kumar, I have a doctor telling me that stress doesn't cause any disease. Oh, my Lord. Really? Maybe you need to find a new doctor. And I will say this. I grew up in a Southern Baptist work ethic environment and used to ignore stress-related comments as well.
Mm-hmm.
Until I started actually looking at the data. And you know what? The data is just, the evidence is undeniable. You can't deny it. And those of us who would love to ignore poo-poo stress as a cause of disease, it's just, you're fighting an uphill battle. You're shoveling against the tide. So, Kurt Bryant, is there a test for elevated cortisol? This is another really good point. I've had many patients who wanted to go down that path. In fact, I've had a couple of patients who the evidence was not so clear about insulin resistance. They clearly appeared to have some problems going on, but they didn't show quite as much as you would have expected in the OGTT and insulin response. Here's the problem with cortisol. Yes, it does. If you look on a population basis, we have a spike in the morning. It's what causes what we call the dawn effect, DAWN. And that is people's blood sugar and cortisol often tends to increase in the morning. Between 3 and 5 in the morning, you get that increase in cortisol. And people like to, you know how people like to talk about what happened in prehistoric times with authority as if they were there. So, you know, it's awfully tempting to do that. You know, we assume that cortisol bump in the early morning was built to help the hunter-gatherer get up and start about his or her day. Whatever the cause, the bottom line is vast majority of us get a bump at between 3 and 5 in the morning. And you see it with blood sugars. 20% of us will have what's called a dawn effect. Fasting glucose, haven't eaten anything in 8 hours, but still your blood sugar's higher before breakfast than it is afterwards. Any comments, Kevin?
Hey, yeah, I have personally observed the dawn effect in myself. And I have done both detection methods for my 24-hour cortisol cycle, done that by different lab techniques. Of course, we can measure a cortisol level in serum, but that's a one-point measurement. With this being a dynamic reading, we can do this by salivary analysis or dried urine. Very interesting when we add the data points in for that cortisol awakening response, that brief spike that occurs on top of this undulating wave of cortisol through the day. The other important thing when we're measuring cortisol is that we do a ratio of the cortisol against something called DHEA. And that provides more insights into what's really going on with overall adrenal health. If we're in a catabolic or an anabolic state, are we building tissue or are we breaking it down? So there are a lot of insights that we can obtain there. What we see with insulin resistance is often it becomes kind of an echo of this adrenal dysfunction. So remember that we operate in systems. Too often in organized medicine, we've broken all of these issues down into little isolated segments, as though all we are is a collection of parts. But this is an intricate system that works together, body and brain and emotions. So all of these things are tied together. It's the brain, it's the pituitary, it's the endocrine glands, it's all of our tissues. It's all a dynamic system.
Speaking of dynamic systems, skunk ape is one of James's favorites. He's always given his sarcastic perspective on it. He said he'll be right back. The liquor store just opened up, and he's going to get some cigarettes and a pint of vodka. That's certainly a common way of managing stress. Erlander FR. So test for C-reactive protein. What's the difference between C-reactive protein and HS C-reactive protein? Which is most accurate? Both of them are testing for the same thing. It's a protein made by the liver in response to stress. There's a heck of a lot of what we would call biological false positives. Before I get to that, though, just real quick, HS stands for high sensitivity. And yes, it is the one that is the most accurate. That's the one that we test for in the cardiovascular inflammation panel. Excuse me. C-reactive protein alone, that's what Paul Ridker, Gavin Blake, and many of the others that do these large studies of cardiovascular inflammation, they look at HS CRP as an indicator of cardiovascular inflammation. Now, we look at a lot more than that. Why? Because we've got an N of 1. We don't have an N of 40 or 50,000. So when you've got 40 or 50,000 people in your clinical study, the guys that had a positive HS CRP because they just had a flu shot a couple of days ago, that sort of gets filtered out with those large numbers. We can't rely on that when we're seeing a patient with an N of 1. So if it's that one individual, how do we rule out other causes, other things going on? And I mentioned flu shot. If we give 100 people a flu shot today, 48 hours from now, 66 of those people will have a positive HS-CRP. So again, how do we deal with that? We look at more of a panel. It's a known adage in medicine. If there's a panel of tests, there is no one single good, reliable test that you can hang your hat on. And that's the case with cardiovascular inflammation. So we look at other things too, like myeloperoxidase, MPO, LPPLA2, plaque 2. That's both of those are enzymes made by the immune system. When the immune system is finding plaque in the artery wall and wants to dissolve that plaque. Myeloperoxidase is released by one group of immune cells called leukocytes or polymorphs. LPPLA2 or plaque 2 is released by another group of immune cells called macrocytes or foam cells. So those are two of the major ones. There's another test. Those are two actors in the cardiovascular play, meaning they create the cardiovascular inflammation. In and of itself, you see it, you can pick it up in the blood. The HS CRP, C-reactive protein, as you may know, is a response to that inflammation. There's one more response to that inflammation, which is maybe the most important test of the inflammation panel, and that is MACR, microalbumin creatinine ratio. That's basically a test of how well the intima or the lining of your artery wall is. in terms of permeability, because that intima or lining of the artery wall is also the filter membrane of those million filters that we have in each kidney. The docs call them glomeruli. So if you're spilling the most common protein, albumin, if you're spilling that protein in through your filters, your kidney filters into the urine, then you're also spilling LDL, cholesterol, small dense LDL from the bloodstream itself into the artery wall. That LDL won't go past the muscle layer, the I'm having the media layer. It won't go there, so it stops between the intima and the media. Recent research, I mean, we used to think that there were holes in the intima, and that's what was allowing that LDL to pass through. Recent research from the University of Texas medical branch just a couple of years ago indicated, nope, it's not that you have holes in the intima, it's that these intima cells actually get injured, and they have what they call transcytosis. Trans meaning through, cytos meaning the cell. So the proteins and the LDL were actually just transmitting through the cell. Any comments about that, Kevin?
I think that's a really important point to be made, is that measures of the integrity of tight junctions at very important biological boundaries, like the vascular endothelium, it's analogous to measuring zonulin as a marker of intestinal hyperpermeability. So it's another one of these markers that comes from conditions that may loosen or weaken the tight junctions along a cellular barrier. That's really important. So the gut is also a major source of systemic inflammation. But the vascular endothelium probably echoes that function. And not only is atherosclerosis, but there may be other processes that really depend on kind of a leaky vascular endothelial lining.
You bring up a good point with zonulin. If the whole story behind zonulin is a very interesting one. It has to do with another thing that people thought were very subjective, like this whole issue of stress. They thought a gluten-free diet was a very subjective thing. Well, at the end of the day, there's a fellow named Alessio Fasano. He's a gastroenterologist, an Italian gastroenterologist at Harvard now. And he has a huge zonulin research program. They have done the DNA. They've done the actual DNA sequencing of the entire zonulin molecule. Zonulin is actually a precursor of haptoglobin 2. Haptoglobin 2 is very important for decreasing cardiovascular inflammation in diabetics. That's a whole different story, which again has a lot to do with both cardiovascular inflammation and gluten-free diets. So if folks have an interest in going there, we'll have to do that. I've got a couple of videos on zonulin. John Zhang, meditation helps to release stress. How should I breathe while doing meditation? You were starting to go there a few minutes ago, Kevin. You want to go back?
Great question. Not a short answer to that one. Lots of ancient practices. What is, when we're doing meditation, what are we focusing on? So the breath work becomes a strategy, or it's a component of a particular type of meditation. So that requires a heightened sense of awareness in some very, very specific and careful instruction. So that's not, unfortunately, it's not a quick answer.
I'll give my quick version of it. There are 3 or 4 things that you do need to think about. Again, number one, this thing about respiratory rate, slowing it down doesn't mean just trying to breathe a little bit slower. That's one of the reasons why the actual research on blood pressure has shown that device-guided breathing actually has an immediate and long-term effect on blood pressure management, believe it or not. Again, people don't tend to think of that as real. And I've covered the science a couple of times on videos. I keep meaning to get back and do that. I did a webinar a couple of weeks ago covering specifically that respirate device. So one thing is much slower breathing, as in about half the rate we usually go. Normal rate's about 20. 10 to 11 is a much better rate. As I mentioned before, prolonged expiratory phase compared to the inspiratory phase. So breathing in through your nostrils, breathing out through your mouth, that helps. Prolonged expiratory phase. And as Kevin mentioned a couple of times, use of the diaphragm. So your stomach is expanding, not your chest. So again, quick hit on a couple of items.
Right.
So
And
we mentioned, did you want to say something?
Oh, I'm sorry. If I could just interject, when properly trained, the breathing efficiency improves dramatically. And that's a very important point about nasal breathing. This is part of the whole breathing apparatus. Pressurizes the air appropriately, moisturizes it, and oxygenation is actually more efficient with nasal breathing as opposed to mouth breathing.
So I actually learned about diaphragmatic breathing when I was in high school. I was in the band. My family did not want to pay significant money for an instrument, so there was a free bassoon. So I went from a saxophonist to a bassoon player, and within a couple of years, I actually became all-state bassoonist. Now, in the state of South Carolina, that meant I was the 4th best bassoon player in the state of South Carolina in high school. There probably were only 4 bassoon players in South Carolina in high school, but one of the things that I did learn was breathing with your stomach. It feels weird. We're not used to it, but it is the way to go. So, and it just takes a lot of training. So Ashwan I mentioned earlier, I'd not seen Ashwan's name. He said, this is his first time joining in. Thank you for joining us, Ashwan. John Bondi, please comment more on sleep apnea devices. Kevin, are you able to give us a little bit of more information on that?
I remember one of the presentations that you've offered on the channel before is a very simple, it's a bite guard, but it repositions the jaw
right
for more efficient and non-obstructed breathing at night. So it doesn't necessarily require a high technology solution, but it's proper positioning of the jaw and the tongue to free the airway from those repetitive obstructions.
There's a thing called mewing. Have you read about that or seen it? MEW.
No, I'm not familiar with that.
ING. It's talking about your posture, how you hold your tongue, how you hold your jaw. And I had never seen it until I started looking some of this up. It does have an impact on whether or not that soft palate drops back into your airway. One of the biggest generalizations about sleep apnea devices is that up until 3 to 5 years ago, yes, it was there. People knew about it. It was sort of like neurology, where it's a whole specialty where we know it's important. It's just that they didn't seem to make that much of an impact. Same thing with sleep and sleep apnea devices. We knew sleep was very important. We still know that. The devices, though, themselves tended to not have that much of an impact. And the major reason was people just didn't keep them on at night. Well, again, over the past 5 years, that has begun to change dramatically. So it's sort of like that old Ford or Oldsmobile commercial. Have you driven your? It's not your father's Oldsmobile or something like that, or have you driven a Ford lately? If you've tried those sleep apnea devices in the past and were unsuccessful, or you heard about a family member or someone else who tried them and they were unsuccessful, that doesn't mean that that's still the case. It's incredibly important. Huge progress has been made just over the past few years. You may want to try that again. Millard Woods, other than blood or urine tests, are there simple ways to find out my cortisol is up? And are there any easy ways to lower it at these times? Thanks. Well, obviously, that's a big deal with the stress that everybody's been going under with the pandemic. Yes, there are tests, but they're all, like you say, they're all blood and urine tests. And I tend to use them very little. As Kevin mentioned a few minutes ago, he's done several 24-hour cortisol tests. That is about as good as it gets right now. You start trying to test for specific levels during the day. And we know that's important because we know the impact on blood sugar. But the bottom line is, again, the science of testing for cortisol, at least in my experience, just isn't quite there yet. Kevin, maybe you've had some experience that I haven't. You have any comments?
I think we're looking here for reproducibility, reliable results. And so there are a couple of labs that I use for cortisol testing that can provide us a very reliable result. Remember that the data you get back also depends on the quality of the specimen. So this is not just like going to the lab and having a one-time blood draw in the morning. So this requires some effort through the day when you collect the saliva or when you collect the urine, and very, very careful handling of those specimens. But the results we get back, there are some well-established reference ranges. And the lab is, some of these lab tests are very sophisticated in determining metabolites. So not just the primary thing you're trying to measure, but its related metabolites. So there's a lot of insight on how well these enzyme systems are working, how well cortisol, DHEA, sex hormones, these things all work in concert. So that relates to the lab methods. The second thing to remember is if we're trying to bring adrenal function back into balance, that is a multidisciplinary approach. That's our diet. That's the gut health. That's the ecosystem inside the gut. Other things that create sleep disturbance. So bringing all of this back into balance, it takes some time. Often there are some nutritional insufficiencies or deficiencies that we can support that help the body re-regulate itself. It's very rewarding when it happens, though.
So thanks. We'll go to Erland again. So Erland had said, according to Paul Ridker, that's the cardiologist at Harvard that I mentioned a few minutes ago. He was one of the early guys in terms of talking about cardiovascular inflammation. HS CRP is the test needed to determine severity. I think you meant severity of inflammation. HS CRP measures the activity of IL-1 beta, IL-6, IL-18. Please comment on this. I will just say that, yes, as we've already mentioned, HS CRP is important. Again, somebody like Ridker can use it in studies of tens of thousands of people, but we need a little bit more when we've got an N of 1. So we talked about that. And if you missed that, you may want to go back and take a look at that. I'm not going to put the others through that again. One thing I will say, though, is that you mentioned all these ILs. IL stands for interleukin. There are multiple biomarkers of cardiovascular inflammation. Many of them, like these, look at immune system, specific immune system functions. So again, C-reactive protein is a protein made by the liver, but all these others, ILs, the interleukins, for example, are biomarkers that come from the immune system itself. Leukin is I think a Latin term for white, and it's talking about white cells. White cells compared to red cells. Red cells are for carrying oxygen. White cells are the cells in the blood that are involved with the immune response. Anything to add to that, Kevin?
Yeah, the HS CRP is a valuable marker, but I don't know, I heard this this phrase, if you've ever heard it, data tells a story by the company it keeps. So when we make a biological measurement, when we look at a biomarker, it's the context of these biomarkers that is so helpful. One that we talk about a lot with insulin resistance, it's the ratios of things like HDL to triglyceride. So bear in mind that HSCRP and other markers that you spoke of earlier, LPPLA2, myeloperoxidase, those become even more specific, almost as though they're on kind of an ascending scale that tell us more about what is truly going on. What is the vascular temperature inside? So some go from very non-specific, an ESR. HSCRP moves us a little further along. But then when we start to get up the scale, LPPLA2, fibrinogen, myeloperoxidase, some of these are they're markers of a lot greater burden of endothelial dysfunction in the vascular system.
Thank you. We've got a heck of a lot of comments and not quite so much time left, so I'm going to try to get through a few of them. Thomas Handyside, great comment. Thank you so much. There are phone apps available to help with breathing exercise. And again, I can't emphasize enough. Yes, it helps if you've trained for 20 years as a monk to breathe better. But those of us who haven't done that, invested that kind of time, we could use some help. And the devices are a big deal. Ashwan Kumar, we see a clear link between chronic stress and any illness. Stress causes inflammation. Chronic inflammation leads to disease. How do we identify and lower the inflammation and potentially reverse it? Well, again, that's what I do for a living. That's what
we're all about.
What Dr. McChord does for a living. Martha Reich, I believe cortisol is part of my health problems. It probably is. I have a very stressful job for at least 5 years. In 2019, I went from one health problem to the next. The reason I retired before I really wanted to. That is part of the challenge. I mentioned people that have to have some kind of stress. There's eustress and then stress. Eustress is starts with EU. It's supposed to be good. And there are people that really enjoy having something to do. I think all of us are built to where we're better off having the excitement, having a goal, having something we need to do on a regular basis. But the dividing line between something being stressful and stressful in a bad way can get blurry. It can get very blurry very fast. So that becomes one of the big challenges in terms of life. And that's one of the things I shared when I left one of my previous jobs. I had looked forward to it for a long time, but then should have known better. Oh, brothers, keto lowers inflammation. It does. It lowers inflammation from insulin and insulin resistance. Absolutely. Elevated blood sugar and elevated insulin are major causes of cardiovascular inflammation. In fact, they probably cause about 80% of it. So when you look at that from that perspective, and the fact that that's the major cause for heart attack, which is the major cause of death, and stroke, which is like number 3 cause of death and number 1 cause of permanent disability, this issue insulin resistance, cardiovascular inflammation is causing the vast majority, probably 80% of death and disability. Wade Taylor, I intermittent fast, 16-8, is the dawn effect the reason I involuntarily wake up almost every morning between 3 and 5 a.m. I wake up almost every morning between 3 and 5 a.m., and a lot of people do. And I do believe the dawn effect has something to do with it, or at least that diurnal rhythm from cortisol. I see you nodding your head, Kevin.
I would agree with that, and not to ignore the prostate bladder connection as well.
So English for free, 01, regular consumption of turmeric lowers cortisol. Bambi Grade, yes, more talks on zonulin, please. We won't have time to do that today, but I'll see if we can get some of those slides out and cover that. English for free, turmeric also improves the endothelium. Well, anything that improves inflammation is going to improve the endothelium. Oh, brothers, most people are deficient in magnesium. There's I can't remember the name of the magnesium I'm taking. I used to take a couple of different types. I'm trying this liquid form right now. Most people are deficient in magnesium, I keep hearing, and that is true. Magnesium citrate is the wrong form. It's not the solution, clearly not by itself. Unbuffered bisglycinate is the correct one, effective for inflammation. Any comments about that? I'm not an bisglycinate aficionado. I can't really comment on it.
Most of the time, magnesium oxide is completely useless and not a bioavailable form. Other chelated forms are much more absorbable. Some people experience rather unpleasant GI side effects with mag citrate and mag sulfate. But yeah, that can be fine-tuned. There are other forms that are highly absorbable, and it is a very important piece of righting the imbalances in adrenal function.
Thank you. John Zhang, does Wim Hof breathing help? You know, Wim Hof has several components to his breathing. One is an increased amount. I don't know how much actual proof has gone into all of his different types of breathing. I've tried some of it, and I thought it was very helpful. It really did help me learn how to slow down. Any comment?
I've used it as well. Yeah, I've used it as well, and I think there's some real merit to that method.
Erland, Headspace is a good meditation tutorial app with helpful instructions. Lots of other apps available. I agree. There's a lot of stuff out there. Take a look. Wim Hof, Blue Wizard. Wim Hof will help you understand proper breathing for sure. I think you've got two Wim Hof fans here. Very helpful advice, Dr. Brewer. Apnea. Most will benefit from reducing inflammation, losing weight, low carb, and keto. Yes. Right. Most of us have too much body fat, and that drives insulin resistance. And as we get into middle age, most of us start losing our ability to respond to insulin. So we get, by definition, insulin resistant. Wade Taylor, I've read niacin should be taken with statins and red yeast rice. Would that include Crestor? So that's opening up a huge topic. Niacin is one of the things that has impacts on multiple areas of our blood lipids. It's sort of like statins in that it helps in terms of the blood lipids, but it comes at some cost of furthering insulin resistance. I don't really think we're not going to have time to get that deep into that today. That is a much deeper topic. In fact, I'm going to try to zip through a couple of others. What's your opinion on ashwagandha? I've read about it. I've seen it. I've used it a few times. I'm not going to be a great guy to give you advice on that. Any thoughts from you, Kevin?
Ashwagandha is an adaptogen, and there are a number of them that can benefit adrenal function. Remember that none of these Remember, we can't supplement our way out of a bad lifestyle. These items have their place. They are tools to help us rebalance. So ashwagandha has a role. I wouldn't look to it as a cure or a substitute for a drug. But it does have benefit in restoring adrenal dysfunction.
Wade Taylor says he takes 500 milligrams and it helped his testosterone level.
Testosterone, yeah.
So we've got too many comments to cover today. Thank you so much for your interest. Any other comments before we leave?
Hey, just one final thought here, to remember how chronic stress that we've talked about today, multiple sources, but they typically revolve around our sense, our feeling of being disconnected, alienation from our authentic soul mission. We get disconnected from our own bodies, from nature and the natural world around us. So healing restores us internally, but it also reconnects us in relationship and in proper place in the beautiful world we live in.
So you know what? That may have something to do with, to get back to the original research that we covered, one of the major countermeasures was having that social structure, that social support. Good way to end. Thank you so much for your help today.
Thank you. Oh, pleasure. Thanks to you and to the PrevMed audience.
See you next.